Hi, this is Julia Rush, and welcome to my final presentation, Proposal on ABC Healthcare. So the background of this organization and the problem is that ABC Healthcare is a large healthcare organization. They spent about $20 million to purchase and implement a new electronic health record, an EHR. The goals were to improve patient care by enhancing communication and access among healthcare providers within the organization. There's several acute care hospitals under the umbrella of this organization, and in particular, there is an adult facility and a pediatric facility. The adult facility was the leader for the new EHR system, and the pediatrics facility was made to follow suit behind the adult facility, but they were left out of discussions, planning, acquisition, or implementation of the new system. So when the implementation phase made its way to ABC Healthcare, there was a lot less effort and emphasis being placed on staff training, and this left many employees unprepared to go live at their facility. The staff at ABC Healthcare felt that the new system didn't meet their needs or the needs of their patient, but they had no choice but to use the system because this was what was presented to them. Morale quickly plummeted, and major frustrations were seen throughout the hospital. So the staff made workarounds to make the system work for them, and the workarounds included charting on paper and then transcribing that information into the EHR at a later time. All of this led to poor time management, inaccessibility of the information by other users until the data was transcribed, and it actually led to safety breaches as well. The intent of the new system was being skirted, and the changes needed to be quickly made to steer the organization back on track. So the proposal here is to refocus the implementation strategy and apply a new training and remediation program for the clinical staff. This will include obtaining staff input about the functionality of the EHR, and it will also include assessing where the staff feel that the system is deficient. Changes are then going to be made in a redesigning of the system, and the workarounds are going to be eliminated immediately because they've obviously led to safety issues already. So the needs that were highlighted for ABC Healthcare, they need a robust EHR. They need quality and efficient information flow among healthcare providers, among the nursing staff and the physicians and other people that play a part in patient care. They have a need for patient safety, and they also have a need for staff satisfaction. So the proposed risk analysis strategy on how the organizational needs can be met in accordance with applicable laws and standards. So as we know, under HIPAA, the HIPAA security rule, covered entities are required to conduct a risk assessment. By completing a comprehensive risk assessment, ABC Healthcare can guarantee that they're compliant with laws, and also they can reveal any potential opportunities that they might have to help shore up their systems. The analysis will include evaluating the organization's administrative, physical, and technical safeguards. It will assess existing policies and procedures relating to limiting access to only those who need it and safeguarding the protected health information. The risk analysis will question usernames, use of solid passwords, as well as how frequently passwords will be changed. The risk analysis will encompass workstation security. For example, it will look at is there a system in place to log users off for periods of inactivity. Encryption will be looked at. Hardware and mobile devices will be assessed. System backups will be considered along with downtime, procedures, and what does the organization do in times of emergencies in terms of health information and how it's safeguarded during an emergency. Audit reports will be generated and evaluated by leadership, and lapses will be addressed. Ongoing security awareness and training will be evaluated and fine-tuned as it's deemed necessary. So there are essential components of decision making in healthcare organizations, and they include planning, analysis, design, implementation, and support and evaluation. So decision-making model helps healthcare leaders follow a step-by-step process to make good quality decisions that enhance care, create value, and reduce waste. Good decisions that are evidence-based lend support to the decision and help define the success of the different initiatives of the organization. Particularly in this course, we looked at the system development life cycle. So the first phase of that is planning and analysis, and this stage revolves around the problem or the initiative that the organization is trying to solve or achieve, and is in line with the strategic goals of the organization. The second phase is the design phase, and this considers the various alternatives that are available to the organization. There are a multitude of information systems out there that opportunities, options. There's self-developed systems. There's purchasing a ready-made system. Plenty of vendors out there that have cloud-based systems or other electronic systems that they're happy to sell organizations. So this phase looks at all the viable options along with their costs versus the benefits, and it attempts to choose the best system to meet the needs of the organization and to solve the problem at hand. The third phase is the implementation phase, which here at ABC Healthcare was a major failure. The implementation phase occurs after the new system has been chosen and all business agreements have been finalized and the system is ready to move into life. Had this phase been carefully planned and brought to life, I think a lot of the negative impact that occurred at ABC Healthcare could have been minimized. The implementation phase of the system development life cycle is crucial and cannot be underestimated. There are resources in the form of finances as well as personnel that must be spent to analyze workflows, system setup, hardware, installation, training, and all this plans and helps prepare for go live. The fourth stage of the system development life cycle that we look at here is the support and evaluation phase. And this basically begins after implementation is done and the system is up and running. This is as important as the other steps of the process. It involves ongoing support of the new system in terms of staff support, upgrades, managing technical problems, and working to avoid downtime and working to remedy downtime when it occurs when it's not planned. Support and evaluation stage remain in place until the part of the life cycle remain in place until it's time to move on with another system. So when this occurs, basically the life cycle has ended and the new life cycle begins. So the problems that faced ABC Healthcare were deeply rooted in the new system. The failures that came along could have been avoided if a proper decision-making model would have been carefully employed and from the beginning of the project. So using a model like this helps to improve decision-making and leads to better, more effective decisions. So the determination of the impact of technology on cultural factors in healthcare provisions and decision-making. So technology can have an impact on cultural factors in healthcare provisions and decision-making. There are many cultural factors of an organization that the organization itself has its own culture. The employees bring culture, the patients, the community. All of this can influence decision-making and technology. Technology has increased the demand for quality in many industries, and healthcare is no exception. Many people in the United States have access to mobile devices, computers, the internet, and many people use all of these technologies to search for answers to their healthcare needs and to double check what they might have been told or what they might have heard. There are socioeconomic, sociodemographic, and cultural variables that can influence and impact technology on quality healthcare that can make desired outcomes difficult, even though the goal of technology in healthcare is to improve the delivery of care. So patient culture, education, responsibility, all of these things can greatly impact the quality of care. Healthcare providers need to be culturally competent and aware of these variables and assess the technological ability of their patients and tailor the care and keep the cultural aspects in mind. Healthcare organizations and professionals can use technology to improve the quality quality of care, quality delivery of care, only to the extent that the patient is able to understand it and personally benefit from it. Um, So there are many different key players that have a role in the strategic planning and continuous quality improvement of an organization. Strategic planning and continuous quality improvement is complex, and the various players need to understand this. The different players have different levels of expertise, and some of these different players are the board of directors, including the CEO, the CFO, the CNO, the CMO, and the CIO, among others. They all have a responsibility for planning and directing the course of the organization. It's also important to develop relationships with stakeholders such as medical staff, patients, and insurers, because they are also key in the development of the strategic plan and ongoing quality care. So enterprise-wide data and healthcare governance. Enterprise-wide data healthcare governance sets the framework for managing health information by meeting the needs of secure data collection while extracting value and information from it. When healthcare information governance policies are in place, organizations can safely gather, revise, adjust, store, retrieve, delete, and ultimately use data as information for practice and improving patient care. Enterprise-wide data necessitates continuous monitoring, and health information governance provides a framework for data management so that organizations can gain value in a secure way that's compliant with law. So the roles of technology and enterprise-wide information as it relates to data governance, there are kind of pros and cons. There are accuracy, reliability, usefulness, and protection of data. And then there's risks, and these risks usually revolve around human error, which can lead to data breaches, failures, and protection of data, or failure to protect data. So moving on to best practices and policies as they relate to data governance, information exchange, and technical and structural interoperability. So capturing and exchanging health information, remaining legally compliant, reducing costs, and improving care all are ways that organizations can be proactive in identifying risk and implementing practices to avoid risk, reacting and resolving issues quickly, and enforcing standards. So the economic impact of the proposed system here for ABC Healthcare, actually, it doesn't require the acquisition of a new system, but it needs to redesign the current system with the input of staff. The resources are going to need to be allocated for funding for vendor support, funding for the design, funding for training of staff, extra staff support, and then there will definitely be some overtime accrued during all of this. However, the economic benefit is there's going to be reduced risk, efficiency, and staff retention due to greater staff satisfaction. So some questions that the board is going to want to have answers to is, what was the problem in the first place? What led to this? How will the plan safeguard against a repeat of what just was experienced? And what is the value that will be added to our organization if we follow the proposed plan versus mandating that the staff use the system as is? So the problem that was faced in the beginning was spoke about in the introduction, basically a failure to assess the needs and failure in the implementation process. The proposal will eliminate a repeat by stepping back and correcting the problems that should have been addressed. And then lastly, the value that will be added will be both tangible and intangible. Healthcare, ABC Healthcare will see efficient flow of information that is accessible by all providers. They'll see a time savings and improved patient safety and staff satisfaction. Not all of these values will have a dollar amount attached to them, but the rewards and the return on the relaunch will be priceless. So in conclusion, ABC Healthcare has an enormous challenge on their hands, but with the implementation of a redesigned, strong resource allocation and a hefty targeted staff training, ABC Healthcare will be able to reach their strategic goals and add value to their system while improving healthcare delivery and patient safety to their organization. Careful and intentional decision making by leadership that incorporates life cycle models of planning, analyzing, designing, implementation, and support and evaluation are key to help this organization overcome their hurdles. Technology is a great tool